pertussis case or whooping cough case. Here to tell us more about it is from Public Health is Annette Uggan, who is the program coordinator. Thank you so much for coming on. Great to have you here. First off, Annette, maybe you could tell us how you were able to get this type of information and how was Public Health able to confirm this?
Well, with pertussis or whooping cough, it is a class 1 reportable disease. There are certain communicable or infectious diseases that private providers and the hospitals are required to report to public health, only because certain diseases can spread quickly in the community, and we want to be able to contain it and prevent further exposure in cases. And so this individual was actually examined by a private provider. They were able to perform the necessary testing to rule out the type of illness, and we did receive laboratory confirmation that it is pertussis.
How old is this child, and does this, I guess, infectious disease happen only with children?
No, the case is a 5-month-old, and with pertussis, it is actually more serious in infants and young children. However, it does affect older children and adults. For adults and older children, it may seem like a common cold for us, a bad cough, persistent cough. Our main concern is for those who have immune system disorders or the younger children and infants who are just developing their immune system. Pertussis can lead to some serious complications, hospitalization, and even death.
And maybe you could talk about the signs and symptoms. Of course, how could you, I guess, determine if it's just a cough or cold versus pertussis?
With pertussis, it's a persistent cough that normally lasts more than 7 days. The cough actually worsens. For the younger children or those who have the more serious complication, you actually hear a whooping sound, hence the name whooping cough, when they're trying to take in a breath. With pertussis, it does cause an individual to have coughing fits, where they cough for a long period of time. They turn blue because they can't catch their breath. They even have what's called pertussis vomiting, where they vomit after they have a coughing fit.
And why is this, of course, of serious concern? And when was the last time Guam had a reported case?
With pertussis, the last outbreak we had was actually in 2006. We had about 87 suspected cases reported to Guam Public Health. Of that, we had 7 laboratory confirmed. We had approximately 58 that were probable cases, meaning that they meet the clinical case definitions of pertussis, but either they didn't have lab work done or the lab work results were inconclusive. And then the remaining 22 were actually determined to be not pertussis and ruled out.
And how long does, I guess, an individual have this?
With pertussis, normally the cough lasts more than 7 days, sometimes 14 days. The issue is because it is airborne, it's communicable, it's easy to be exposed to and to catch be exposed to the bacteria. It's easily spread, and so we want to protect the infants, those with immune system disorder. We want to avoid having any type of outbreak, only because, like I mentioned earlier, people might think it's a common cold or bad cough, and little do they know they're exposing other individuals, be at home or at school, at work, and then we have to deal with trying to contain multiple suspect cases.
And last comments. Of course, Public Health has always monitored something like this, and we want to make sure that the community is, I guess, knows the signs and symptoms and why it should be reported, or they should see maybe a doctor or physician.
For us, Public Health, we always want to promote prevention. Vaccination is the best way to prevent an individual from coming down with pertussis. For children, it is actually recommended at 2 months, 4 months, 6 months, and then at 12 to 18 months of age, and then again at 4 to 6 years of age. A few years ago, CDC recommended an updated vaccine called Tdap. It's the TD booster that the older children and adults would get every 10 years, but they added in a pertussis component because they did notice that teenagers and older adults were the ones coming down with pertussis. They did have several pertussis-related deaths in adolescence, and so that's why they came up with this Tdap. And we want to encourage individuals who have a newborn child, grandma, grandpa, uncle, auntie, the babysitters, older siblings of newborn children or young infants, to please see if they need their Tdap vaccine. It is recommended only once right now, but it is to protect those who can't protect themselves. So it's a two-way. Immunization works. The individuals who immunize protects themselves, but also they protect others who can't necessarily get the vaccine due to age or medical condition.